every day in the mirror I see a woman, and every time I look in mama I see the woman.
Hi comrades, I trust you are all doing well. Welcome to the Breast Cancer Awareness Series. My name is Aisha Abubakar, and of course I won't be doing this alone. So I have with me...
My name is Mimi, and today, in collaboration with the Women NUGS, coming your way with breast cancer. Breast cancer. But wait, before you touch that, or before you zone me out, or probably click off, just relax, cool down. Let me tell you something. Nobody ever has breast cancer until they are told you do. That is one. Secondly, it's better safe than sorry. How about you just listening to me for listening's sake? I mean, I know who did take a wine. Just listen for listening's sake.
Breast cancer is a disease in which the cells in the breast grow out of control. After skin cancer, breast cancer is the most common cancer diagnosed in women in the world. Breast cancer can occur both in men and in women, but is far more common in women.
A lot of things complement us as women, inside, outside, but then let's go a bit physical today. One of the most prominent, or let me say, the most statement part of the body of a feminine is the boobs. In normal cases, it's only a woman that has protruded breasts like this, or let me say, fatty breast. Did you even know that it's fat in your boobs? Later. Having said this, breast cancer is that tumor or that destroyer that destroys our power. Also, breast cancer doesn't only happen to women. In most cases, it is a women disease because we have the boobs in the obvious, right? But men also can get breast cancer. So if you're a man, don't touch that. Listen to me. Come here. Listen to me. Up to date, there is no actual cause of breast cancer. Can you imagine? There is no actual cause of breast cancer. But there are risk factors. The difference between risk factors and causes are direct bring up of a situation or direct build up of a situation, whilst risk factors gives you probabilities of having it. So think about it like this. Causes are what you get that can make you have breast cancer, but then risk factors happen to be things that may influence breast cancer. So it doesn't necessarily give you breast cancer, but it can influence breast cancer. Alright, let's rush through some of the risk factors. Breast cancer is mostly detected in a woman. Having said that, a man can also get breast cancer. What do I mean? Out of the world's 100% breast cancer patients, 0.5 of them are males. So you see? But then, why don't we leave the minority side and move to the majority side? How are that? So, it means that the remaining percentage happens to we women. I know, right? So, gender is a risk factor. The fact that you're a woman, you have to be sure that you do not have breast cancer. Age is a factor. The older you become, the more you can get breast cancer. What do I mean? Women ranging from 90 years and above are known as people who mostly are carriers of breast cancer on the normal. They don't even have to do anything. The moment you clock 90, there is a probability. You see, I'm not saying 90 will cause it, but there is a probability that you will get breast cancer or you may have breast cancer. Genetics. Mutation of the tumor. When you have the BRCA1 or BRCA2, you could have breast cancer. It is a risk. Family relation. When the immediate family or the direct immediate family, or think about it as your nuclear family, anybody in your nuclear family has breast cancer, it could be a risk factor. You could also have breast cancer, so do not play with breast cancer. Let's talk about menarche. When you menstruate earlier than normal, there is a risk that you may have breast cancer in the future, okay? Or if you notice that you menstruate, you know, the normal menstruation cycle should be 14 to 15 years. But when you had it earlier, like 12, 11 below, you should know that you may have breast cancer. Also, when you have your menopause so late, menopause is supposed to visit you around 45 years onwards, but then when you get it later, like 55 onwards, there is a risk factor. Let's talk about obesity. Obesity. when you are a little bit overweight, you have to be very careful because you stand a risk of getting breast cancer. A lot of fat, no matter where it is, when you are really overweight, you can stand a risk of having breast cancer. Diet. What do you eat? Your intake. Things you take in. Do you drink a lot of alcohol? Do you not drink enough water? You stand a risk of having breast cancer. Carcinoma of the breast is mostly found in the western side of the world. So Western women also stand a risk of having breast cancer. I know, right? There are two types of cancer. Benign doesn't metastasize, but then carcinoma or malignant metastasizes or spreads. Think about it like this. Benign is non-invasive. It doesn't invade other places. But then carcinoma is invasive and very, very dangerous. And that is why if you're feeling any uncomfortability or you feel like your boob, titties, tata, or your breast is feeling not so normal, you should rush for screening or checkup. Let me just give you a picture of how breast cancer operates. Normally, the body cells divide into several parts for mitosis and meiosis. You know that. Where did you go with science? I didn't integrate science. Mitosis, meiosis. Think about it. There is an actual way or the normal way it divides itself. When we say cancer, the body cells over multiplies and out of that it destroys. You already know too much of everything is bad. Okay? When the body becomes cancerous.
In our next episode, we'll be discussing the signs and symptoms of breast cancer. So you stay tuned. Once again, welcome to the Breast Cancer Awareness Series. See you all in our next episode.